Good morning, everyone. We're still at the morning point of the day. I just want to welcome you all to the Health Professions and Social Services Q&A. My name is Diane Gordon. Can I just ask if you do have any questions for each of the curriculum areas that you're going to get talked through today, if you can post them in the chat and then we can answer them at the end. And to start off with, I'm going to hand you over to Julian Henderson, who will be talking to you about social care. Julian.
Hi there, thanks very much, Diane. So firstly, welcome everybody. To send apologies from our head of school, Caroline Hares, who's actually not feeling well today. So just to welcome everybody here this morning. As Diane said, my name is Julian Henderson. I'm the curriculum team manager for social services. So that is the remit within our team. We, as health and social care, as a subcategory of our school, we are very much focused on all areas, as you can imagine, of wellbeing, health, social care, counselling, working with communities, pharmacy, dental. We have a broad remit, and you will get information from myself and from my colleagues today about each of the specific areas of responsibility that we share. So if you have any questions that are either generic, we can all help you with those ones, or if there are areas of specific interest, please let us know, and Diane will direct them to the appropriate person, and hopefully we'll be able to answer all your questions today. So if I'm going to start, then that's great. So as I say, welcome. My area is social services, so that is the specific area I'm responsible for, and we run 3 levels of social services, formal social services courses. We have an introduction to social services, which is level 5, the equivalent of a national intermediate 2 or national 5. It's a level 5 course. We run a level 6 course called Social Services Professions, which we have just changed the title and reshaped slightly, and we run our HNC Social Services programme. So very briefly, the level 5 course this year, we've made a few adjustments. The level 5 course this year is now going to be a 1-semester course. So if you join at level 5 at Edinburgh College doing social services, introduction to social services, you will study with us from either August to January, and the course would conclude, or January to June. And the purpose of this course particularly is exactly as it says, it's a broad introduction to all things related to social services. So we look at what we mean by social services, and of course that's basically anywhere where people are requiring additional support in society. That is where we come in. So we don't have one specific speciality. You'll find people interested in working in the homeless sector, people interested in working in elderly care, and working with adults with additional support needs and learning support needs, working with drug and alcohol misuse issues, working in dementia care, a broad range of areas. And of course, with each of these areas, we overlap. Each of my colleagues here, we have overlaps in what we do, and that's very much a government focus just now, is to make sure health and social care is overlapping. So you'll get a broad introduction to what we mean by social services on the level 5 course. You will also be out on a placement 1 day a week. So the idea of that is within the first few weeks, we'll settle you in, we'll get you up and running, get you confident, and we'll help you find somewhere that you can go out and actually experience the practicalities of working in a support environment in the real world context. Now, of course, you'll be a student on placement at the time. You'll be very supported by us as the lecturing teams and the staff that are there. And the idea is to really, as a student, to give you some exposure so that what we're talking about when we're teaching you makes sense when you actually go out there. So the purpose is firstly to link the lessons into the reality of the job, and also it's to give you valuable experience, whether you're thinking about perhaps going straight into employment, or whether you're thinking about articulating into the next level of course for us. So that's our level 5 course. Once you've completed level 5, you can jump on board level 6, or you can go straight into level 6 if your qualifications permit as well. Our level 6 course is run in 2 cohorts. So we have a 1-year full-time course, which is from August to the following June. That's a full 1-year course. And we also have a January start fast track. So for those people who are doing the level 5 that finish in January, you can start your level 6 in January. So you don't have to have a break as you go through the cycle. Level 6 is not too dissimilar to level 5. Obviously the academic requirements are a wee bit more. It's school higher level equivalent. That's where you're operating there. And we specialise more at level 6. So the subjects that we look at are much more specific to things like we have a unit on dementia care. So you really look at what that means to be supporting someone and caring for someone in the context of dementia. We have a substance use and misuse unit as well. We have a lot more mental health units. So if you're interested in psychology, mental health, that kind of thing, we look a lot more at that kind of thing. And in amongst the specific skills that you'll develop, you will also have another broad range of skills and understandings of what we mean by social services professions. So you'll look at things like policy and legislation and where that comes from and how we shape it and influence it. You'll look at professional practice and how we become registrants and why that's important to the public and to people within our care, etc., etc. For level 6, you will also have a placement element. So you'll be studying with us. We'll have some online lessons. We'll have some lessons in college, and we can talk about that later on, but we have a fantastic care hub, a digital care hub, a new facility. One of my colleagues, I'm sure, we'll talk a wee bit more about that, but that's, we're going to get you into some practical activities as well. And then the third day of the week will be you out on placement, much the same as level 5. You'll be a student. You're not going to be a full-time staff member. You're going to be a 1 day a week student out on placement, experiencing working in a care sector environment whilst studying at the same time. So from level 6, we then have our HNC, and that is the equivalent, we call it level 7. It's the equivalent of first year of university, HNC social services. And that is a much more theoretical course. That's the top level of what we offer at Edinburgh College. And you really go into the theory of things. You know, we ask you a lot of hows and whats at level 5 and 6. We think more about why at level 7. So we'll really get you to break down the subjects and really think about, you know, what we're talking about when we talk about policy and how that integrates and how we as professionals influence the practice that we are out involved in. Again, there's a 2 day a week placement for level 7 for HNC and 2 days in college. So it's more academic. It is, again, the focus at the end of the day. Everything that we do from level 5, 6 and 7 is geared at professional training. So it is a college course, of course, but it is a vocational college course. And what we're interested in is preparing you to go out into the world of social services practice. We want you to be a confident practitioner when you go out there and to have the best opportunities for the interests that you have, so that you can go out and really make an impact to the sector out there. And the final thing I'll say before I hand over to my colleague Michelle is that, as with all my colleagues around the table here, the virtual table, you know, myself and all the colleagues that I work with, we all come from social services professions in our backgrounds ourselves, and we're hugely enthusiastic about what we teach. We know the industry that you're going into. We're very connected to it still, and you know, we think it's a fantastic suite of courses. So if you're interested in social services, please direct any questions to Dan. I'd be happy to answer them. And I think that's about it for me just now. So I'll pass you on to my colleague Michelle Kai. Oh, and you're on mute, Michelle.
That old classic with the mute. Somebody had to do it, and it was me. So hello everybody and welcome. My name's Michelle Kai and I'm the curriculum team manager for the healthcare courses. So those are the courses that predominantly lead into nursing. And if anything about the last 2 years has taught us, it's how important the health and social care sector is. So if you're interested in these types of courses, I can pretty much guarantee you will get a job at the end of your course. So that's something really positive in our area. It's a really exciting time to come and study health and social care at Edinburgh College, because we've had considerable investment this year in terms of our partnership with Edinburgh University, where we've created a large digital care hub at our Sight Hill campus. So we have a 3-bedded ward with state-of-the-art mannequins and moving and handling facilities. We have prevention of infection rooms. We have a virtual reality dementia room, a care at home room. So you really can be immersed in the learning and teaching in a practical sense. And we also have a similar facility at our Milton Road campus as well. If you're interested in nursing and you're still at school, one thing I would say to you is, if you're doing science, particularly biology or human biology, stick with it, because that is the thing that usually stops people getting into nursing is that they don't have the science. And even from our level 5 courses, we're looking for candidates that would have Nat 4 in science. So it's really important to stick in with science. Having said that, if you don't have science, there are still opportunities within the college to gain qualifications in that at level 4. It doesn't sit in my curriculum area, it sits with science, but there are opportunities available within science as well. So what do we offer? We offer quite a lot of courses at different levels. So our first course at level 5, so National 5 level, is called Introduction to Health Services. And within that course, you do a lot of study on the values and principles we would be looking for in our applicants for nursing. You do some psychology, you look at social influences, about how society influences our health, mental health, dementia, all sorts of things. Totally, all of it from level 5 onwards is aligned to the curriculum that you'd be studying if you go to do nursing at university. From level 5, you can then go on to route to health professions at level 6, or you can go into that level if you have the required qualifications. So route to health professions, most of our candidates at this level will have maybe gained one higher from school, but they maybe don't have the entry requirements that they need for university yet. So what you study there is you do the higher in care, you do higher human biology, and you would sit those exams just like you would in school by the SQA in June time. But you also do a number of other units as well that align to undergraduate nursing degrees. And from the route to health professions, you would then have the qualifications to give you entry into nursing. And it's probably quite important for you to understand that that would give you, and in fact all of our courses would ultimately give you entry to adult nursing, mental health nursing, learning disabilities nursing, or child nursing. We get a lot of inquiries about midwifery. And even with our higher level courses, often midwifery applicants, they would be looking for more at university. So as well as a higher level qualification, they would also be looking for a higher science, and they would also be looking for National 5 maths. So it's worth bearing that in mind, that if you're thinking about midwifery, following the route in college, you'll need to do a bit more on top of that. So after the route to health, as I say, you could go to university from that. Some of our candidates following route to health might feel that they're not quite ready for university yet, and they really need to develop their academic skills at a higher level. So some of the candidates go on to do our HNC in healthcare practice. And it's quite an exciting time for our HNC healthcare practice as well, because historically you do a placement, you do 2 days a week in placement and 3 days a week in college. And historically we've always had a bit of a challenge getting placements in NHS. But we've had great discussions this year. We've really driven that forward, and all our HNC students are now guaranteed a placement in the NHS. And even more exciting, I was just at a meeting today where one of the suggestions I made was that once we recruit you onto an HNC, you could be given a job as a Band 2 support worker within the NHS before you even start your place in college. So, you know, once you've got your HNC, you could be starting that, you know, quite a few months before you even start your place in college. So that would give you lots of great and valuable experience, as well as earning some money. So some of our candidates, as I say, from route to health go on to HNC. Now, these candidates are often ones that either think they need a bit more in terms of developing their academic skills, or they might be going into areas that are more competitive. So, for example, child nursing at university is much more competitive than the other fields. So sometimes it's harder to get into, and students might get a knockback. But actually, going on and then doing the HNC after really proves that you're committed to what you're wanting to do, and it gives you that added academic skills that universities will be looking for. So it really enhances your application for areas that are more competitive. If you don't meet those criteria, there is it is probably worth mentioning, which is one of our biggest courses, we run 5 classes of them, is access to nursing. Now, some of you might be thinking that you hear about that or you see it on the website, but it is worth noting that that is not available for students from school. It's for candidates that have been out of education for at least 3 years. So that opportunity is not available to school students. So it is, what you'd be looking for is either introduction to health services, route to health services, or the HNC. You can, of course, if you have the right qualifications, get straight onto the HNC. So again, you've maybe not got quite what you need for university, but you maybe have a higher in a science and you maybe have another higher, then we would consider you for the HNC straight away. So lots of opportunities there. The other really exciting course that we now run, which we just really did a trial on this year, is our paramedic science course. This is a course that we're running in conjunction with Queen Margaret University. There are only 2 areas really in terms of the west of Scotland and Queen Margaret University or Stirling University that you can study for paramedic science. And it's a very, very competitive course to get into. I think last year Queen Margaret had over 1,000 applicants for about 50 places. So this is a really exciting opportunity because we've been working closely with Queen Margaret University looking at what they would like to see in applicants. So we've very much tailored the course in line with what the university is looking for. So that's a really exciting opportunity. What I would say, if that is something that you're considering, you have to have a very strong supporting statement. You really need to demonstrate you understand what the role of a paramedic is. If you do any voluntary experience, that would be very valuable to mention in your statement as well. The other thing that Queen Margaret are very keen on with paramedic science students is clearly it's quite a physically demanding role as well as a psychologically demanding role. So they're very keen on students that have an interest or they're doing something at school, maybe in relation to exercise and fitness. So acknowledging that in your supporting statement would be quite valuable too. So I think that's probably enough for me because I'm conscious of the time for my other colleagues. But as I say, if you've got any questions or you'd like to contact me out with this meeting, please don't hesitate to get in touch. We're really looking forward to welcoming you in the college, hopefully. So I'll hand you over to my colleague, Laura.
Hi everyone, hello. So my name is Laura Mcclelland and I am the curriculum team manager for pharmacy services and dental nursing as well. I just seen there was a wee question came into the Q&A chat, so I'll answer it before I go on to my section as such. The question about medicine, and medicine actually doesn't sit within our area, which I know seems a little bit strange, but it doesn't. It doesn't sit within this area. So whoever asked the question, Diane will be able to direct you to the appropriate session for you for medicine. Okie doke. So as I say, my area is pharmacy and dental nursing. So we have a range of courses in the same way that there are many courses in the other areas. So with pharmacy, we can start off, there are courses ranging from level 4, level 5, level 6, and then up to HNC as well. So we run our level 4 course as our introduction to pharmacy. That runs from August up until January. So that is our semester 1 course. And this is for people who have an interest in pharmacy, but perhaps haven't had any experience or haven't had any work experience or any prior knowledge of the pharmacy sector. So that's where we would absolutely welcome applicants in for our level 4 intro to pharmacy. Leading on from that, we go into level 5, which, not very creative with our titles, was Intro to Pharmacy 2, and that begins in January. So we have just started with our level 5 course just last week, having great feedback already, so they're all enjoying that. A lot of our students move on from level 4 to level 5 and stick with us. We also welcome applications from people who haven't done the level 4 to join at level 5 in the January. So just because you've not done the 4 doesn't mean we're definitely not going to take you for 5. We do have a few kind of prerequisites around that. So if people we need to have a bit of numeracy, a bit of maths qualification behind you there, because not a lot of people would think about this, but pharmacy, you have to be quite good at maths to do pharmacy calculations. So it is a part of it. So if maths isn't your thing, it can be worked on. We absolutely work with you, but there's definitely an element of maths in pharmacy. Okay. Leading on from there, we do a 1 year, it's called Route to Careers in Pharmacy, and it does what it says on the tin. So we are absolutely preparing you for a career in the pharmacy sector, whether that is in a community pharmacy, which is quite often what people think of. So for example, Boots or Lloyd's on the high street, but there are also other areas of pharmacy as well. There's hospital pharmacy. There's quite often pharmacists or pharmacy technicians in doctor surgeries as well. So there are lots of different careers. There's also pharmacy professionals in prisons and in the army as well. There are lots of different areas that people can go into through pharmacy. So that we have our, as I say, 1 year Route to Careers in Pharmacy level 6 course. All of these courses, you can obviously work through the pathway, you can join at different points. People also exit at different points to go into employment, so anything is possible there. We also run an HNC in pharmacy, and this course, the HNC, is only suitable for people who are registered pharmacy technicians. So people would come back and do the HNC through their employer. So we do get quite a lot of applications for the HNC from people who are not registered pharmacy technicians, but just to be aware, that is really for employed pharmacy technicians. So that is our pharmacy courses that we run. I also oversee the dental nursing area, dental nursing and oral health care. And again, we have a pathway through that as well. So you can start off with an introduction to oral health care. That starts at level 5. And we run that both starting in August and starting in January. You would work through the level 5 course, given a lot of employable skills you will gain through that. We will do things like working with others, we will do communication, you will learn IT skills as well as a good introduction into oral health care, things like anatomy of the mouth and how to take care of your teeth as well. There's a lot of really interesting topics that we cover. You would then lead into our level 6 oral health care course called Preparing for Practice, and that would really build upon that knowledge that you have gained at level 5. And again, those courses run from either in August or starting in January, so we never leave you without something. It always leads into another course starting straight away in the next semester. And leading on from there, you can move into what is called the SVQ in dental nursing. So if your goal is to become a dental nurse in practice and register with the General Dental Council, then we can certainly help you do that through the SVQ. Again, we have people who do the SVQ through their employer on a part-time basis with the modern apprenticeship, but we also have students who are have worked through those different level 5, level 6 and into our SVQ. So it's absolutely a pathway that people can do as a full-time student. And I think that's all my courses, so I will pass over to John, and if anyone has any questions or wants to come along to our open day sessions, then absolutely that is something that you can book in. So I'll pass over to John.
Thanks, Laura. So hi everybody, my name's John and I head up the counselling programmes and our Working with Communities programme. And I'm just going to explain to you a bit about Working with Communities first. So I'm aware of time, so I'll be as brief as I can. What Working with Communities does, it works in the field of adult education, it works with youth groups, with vulnerable groups, many of the groups that Julian spoke about when he gave his presentation just a few moments ago. And it works with those in an empowerment way. And so if you join us to study in that, we've got 2 routes for you, which is the first route would be starting at national certificate, so that's level 6. And if you were starting there, you would have to undertake a placement, which means getting a PVG, which could be explained to you, I'm sure. and you might be working in somewhere like youth work, or in housing areas, working with elderly groups, working with groups, other different kinds of groups, and equality, diversity, looking at principles of community involvement. So quite a broad schedule of learning there. And if you want to progress further, you can progress into our HNC, and that's available both part-time and full-time, so either over 2 years or 1 year. And you would look at a much higher level of community empowerment work and community activism work, including managing resources, studying sociology, and looking at health promotion strategies. In terms of the entry requirements, to enter into our national certificate level, you would need 3 passes at level 5. Or an appropriate national certificate at level 5, and your teachers, I'm sure, can explain what that means. And if you wish to join our HNC, you would need a minimum of 2 hires or a relevant national certificate pass at level 6. The other area I want to talk about is our counselling programmes, which we also provide, and we work throughout Edinburgh, in fact, providing lots of different ways of training people in counselling skills and even training people to become counsellors. The focus of counselling is working in relationship with people, and you would study both the theories and the practice of counselling. So you'd be studying lots of theories about human personality development and lots of theories about treatments. And you'd also be practicing counselling skills. So actually, what is it like to sit in that chair? And if you become a counsellor through our pathway, then the main groups you would work with could be people with mental health problems, addictions, trauma, rehabilitation needs, or you could be working in a private counselling agency. So where that progresses is, you would begin with us on the introduction to counselling level, which starts at level 5 and then progresses on to level 6. And that would be over a year or 2 years. You then progress to our higher national certificate, which is level 7. And as Julian said, is the equivalent of year 1 at university. And that takes, again, 1 year or 2 years, depending on full-time or part-time, by which point we hope to be providing the higher national diploma, which is the final and formal route to registration as a counsellor or psychotherapist. So the journey there is a lengthy one. It takes about, we anticipate 3 to 4 years, and requires placement in those final years. So you'd be working in a counselling agency somewhere in the city or in the area, actually delivering counselling to clients. I think that's all I've got to say, because I'm holding on to time and the boundary of time, because counsellors are all about boundaries. So I will pass back to Diane.
Hi everyone, I think Diane's actually going to have to make an exit, so we're just going to wrap up here. One thing that came up in the questions that was asked of us is, what are we looking for, all of us, in personal statements? And that's a really good question. I'll hand over to my colleagues briefly in case there's anything I've missed, but I would say there'll be some generic themes that we're all certainly looking for. For me, number one, enthusiasm. I would like to see someone enthusiastic and understanding about the area that they are applying for. So when I see someone saying, I want to be working in a social services environment, I want them to understand, or I want to apply for a social services course, I want them to understand what that means. What do we mean by a social services environment? I want the application obviously to be about you, but I want it to be about your understanding of working with others as well. That's really, really important for us, so that you know it's not just about what you're going to get from the course, but that you understand that this is an area of working with others and how you would feel you would input into that. So an understanding of the area, enthusiasm definitely, and a bit of reflection on the responsibilities and the maturity that we would expect to see someone. Because bear in mind, when we have you here and we want you all to be joining our courses, and we think our courses are fantastic, but we also have a responsibility to have people in our courses that are then going to be out working with vulnerable members of society. So, and of course we'll prepare you for that. Don't think that's a daunting thought that you wouldn't have any support for. Of course, that's what we do. We get you ready for that, but we need to see that applicants have the maturity to understand what they're walking into in the first place. So that would be my main comments. Would anyone else like to add anything that I've missed, perhaps?
I think for me it would be understanding the role of the nurse in particular, thinking about quite early on in your college career what type of nursing that you want to go into. So those fields of nursing I talked about, adult, mental health, learning disabilities or child, and what you understand about those roles. And we'd be looking for you to demonstrate you had the attitudes and values and behaviours that we would be looking for somebody in that profession. If you have any experience, whether it is voluntary or if you have paid experience, that's all the better. So tell us about that. And if you have skills, rather than just saying I'm a really good team player, think about how you can demonstrate those things. So if you're listing your values and competence, your qualities, think about evidence that supports you demonstrating those. So that would be additions for me. Thank you.
I'm happy to just talk to you in terms of your personal statement for counselling or for working with communities. The key thing we're looking for is maturity. And by that, I don't mean age, because believe me, I know 30-year-olds who are way more immature than some of the teenagers that I've worked with. But we're looking at emotional maturity. Are you able to undertake courses such as counselling, for example, where we are very much about developing you as a human being, developing you as a personality, as much as helping you to help others to develop themselves. So very much in your personal statement for us, we want to see your emotional stability and your maturity that you're able to actually undertake, because this is really tough work, working with people in the most intimate way. I'll hand you on to Laura.
Hello, sorry, there is a bit of an emergency situation going on in my house at the moment because my dog has ran away in the back garden. So apologies, that's what the frantic moving about. We have spotted him 3 gardens down. So that is the current situation, sorry. So yes, absolutely. I totally agree with what my colleagues have said. Explaining a bit of why you are looking to get into that area. This is going to sound really silly, but please give me a personal statement. There is so many times that I receive an application and it's either got no statement or it is I want to study dental nursing, I want to study pharmacy. As Julian, Michelle and John have all said, give us that detail. What sets you apart from somebody else? Why should we give you the space and not somebody else? So absolutely give us that information. Sell yourself. It is really important to do. You would do it for jobs. You would do it for a job application. So treat this in a similar way. Absolutely sell yourself. So that's really important. And as Julian said, that enthusiasm, that passion, we are all very passionate about our areas, as I'm sure you can tell. We all work in our areas. We're all still really active in promoting those areas, as are our colleagues. So definitely showing us why you want to join the course. And now I will go and try and find my dog.
Thanks very much, everyone. I think that is us in a wrap, and we've run over your time by 6 minutes, so my apologies about that, but we could talk all day about our areas. We love them. We're very enthusiastic, as everyone's saying here. If you have any further questions, please don't hesitate to get in touch with any of us, and if not, get in touch with the college, and it will come through to us. They know who to get a hold of out of each of us, and we're more than happy to speak to any of you on an individual basis if you have further questions at any point. So hopefully this has provided some background information, and it's answered some of the questions that you've needed, and good luck with your applications, and we hope to see you here in August. Thanks very much, everyone. Bye-bye.